Hi, this is DEFENZ, the smart lawyer's way. In this video, we are going to discuss the case of Vinod Jain vs. Santokba Durlabhji Memorial Hospital and another. Medical negligence refers to instances where a healthcare provider fails to meet the standard of care, resulting in harm or injury to the patient. Such medical negligence cases include misdiagnosis, improper treatment, surgical errors, or lack of informed consent. In this case, the appellant Vinod Jain filed a legal petition alleging medical negligence following the death of his wife Sudha Jain on October 31, 2011. The wife had a medical history of esophageal cancer, colon and breast cancer, hypertension and type 2 diabetes. Sudha Jain was admitted in the hospital for fever and chills and was diagnosed with high white blood cell count, indicative of an infection. Her medical treatment was initiated, including IV injection of Magnix. However, the cannula used for IV treatment stopped functioning and oral administration of the antibiotic Polypod was prescribed. Sudha Jain was discharged on October 18 with instructions to continue taking her medications 5 days post-discharge. On October 23, she went into coma and was admitted to another hospital where she eventually passed away. The appellant believed that the medical treatment administered by the respondents and the decision to discharge his wife prematurely constituted medical negligence. He filed a complaint with the Medical Council of Rajasthan, which did not find any evidence of medical negligence, and a subsequent appeal was made to the Medical Council of India, which was also rejected as the time was barred. Let's look at the issue in this case. Whether the respondents are liable for medical negligence or not. Let's look into the arguments of the appellant. The appellant claimed that his wife fell into coma and had to be admitted to another hospital where she was placed on a life support ventilation system. The appellant argued that the medical treatment provided by the respondents were ineffective and inappropriate. The cannula for IV medication was not restarted. The deceased premature discharge despite her condition necessitating ICU treatment. Also, despite her critical condition, oral administration of the antibiotic Polypod, which actually required IV medication. Let's look into the arguments from the respondent. The respondents argued that when the patient was discharged, she was afebrile, that is free from fever, her vitals were normal, she was well hydrated, and neither her chest nor her urinary tract were infected. She was discharged with proper prescriptions for the next 5 days as she was clinically stable. Let's look into the precedents referred in this case. In the case of Bolam vs. Friyan Hospital Management Committee, it was held that it is essential to remember that a doctor is not considered negligent if they follow a practice properly accepted by a reasonable number of experts. In Jacob Matthew vs. State of Punjab, the court clarified that professionals with special skills must provide care and caution but cannot assure guarantee. Let's look into the judgment of this case. The Supreme Court held that in case of medical negligence, a doctor doesn't need to be the best but must use ordinary competence in their field. The doctor in question prescribed oral antibiotics based on the patient's condition and her previous treatments. The National Consumer Dispute Redressal Commission opined that it could be termed as a case of wrong diagnosis and certainly not a medical negligence case. The State Commission's decision to grant damages for alternative treatment was flawed as they are not a medical authority. No evidence of deviation from the standard procedure was found. The death certificate stated that the cause of death was due to multiple organ failures, with her diabetic condition being an antecedent cause. Also, the multiple malignancies, post-chemotherapy and radiotherapy all contributing to her death. The Supreme Court further stated that the NCDRC's reasoning was valid and the appeal was dismissed. Let's look into the review of this case. The legal principles for medical negligence assessment rely on reasonable skill. Even if a commission holds a different opinion, a doctor cannot be accused of negligence if his actions comply with established guidelines. Lack of concrete evidence can protect skilled professionals from negligence claims, reflecting the challenges in defining medical negligence. Thank you for watching this video. Do share and subscribe. Stay lobbyfied.